your audio is breaking up. Maybe if we can just stick to the audio alone, it may work better. Thank you, Doreen. Okay, so maybe in brief, Vusumuzi can also share with us his experiences. Yes, Doreen?
Yes, can you hear me?
Yes, we can hear you. We can hear you. Okay, Doreen, can you please tell us a little bit more about your experiences for those that have just joined in, and because your network was a bit, your audio was breaking pretty badly when you tried earlier.
Hello, everyone. It appears we are experiencing connectivity challenges. So possibly, Vusa, you can come in at this point.
Yeah, sure, I can. I think, I hope I'm clear.
Yes, we can hear you.
All right, yeah, thank you very much. I think maybe just to start by appreciating ZACRAS and UNESCO for giving us this opportunity. It's also an honor for me to share the panel or the podium. Well, it's a podium in its own way with my elder brother Mgoma Chris. Yeah, I think we have learned a lot and continue to learn a lot from him. So just to set the tone in terms of what I'm going to discuss, I think we all agree that fake news and disinformation is a major challenge, especially in this time of COVID-19. And I think community media, especially community radio stations across Southern Africa have been hardest hit, mostly because of the many challenges that they are already experiencing, and then fake news and disinformation, like the current challenges that they're experiencing, expose them more to fake news and disinformation, challenges that border on resource limitations. Most of the community radio stations are already under-resourced, both in terms of finances, equipment, and also in terms of personnel. And debunking fake news requires that you have right skills, you have the right systems, but in most cases you find that community radio stations are not adequately equipped in that regard. As a result, they are not able to adequately inform the communities, give the communities the right information. So at times they just are forced to pick whatever they lay their hands on. And because I think the COVID-19 situation is unfolding very fast. So, but because of the resource limitations that community radio stations face, they may not be able to also quickly move in to verify some information before they share it with their audiences. So, sorry, I was getting some feedback. I don't know if you can still get me.
Please, can everybody mute their mics? If you are coming on, please mute your mics. Thank you.
Yeah, thanks. So also one aspect that we need to pay a lot of attention to is the unique role or the unique position that community radio stations play. First, community radio stations are like they work with the community. They are operated, well, they are supposed to be run by the community and for the community. So that means for the community radio stations to be able to adequately debunk fake news and disinformation, they have to, like the environment within which they operate needs to have a certain systems that or certain enablers for that to happen. So, but like I mentioned earlier, that because of maybe resource challenges, they are not able to get the right people, they are not able to get adequate personnel, they are not able to get adequate equipment. And as a result, in some cases, they find themselves misleading their audiences without intending to do so and without knowing that maybe they are churning out fake news. And also, because of their unique role, community radio stations, they don't just inform, educate, and entertain, but they also stimulate community actions in terms of addressing different development challenges. In this case, in terms of stimulating community actions in adopting maybe preventive measures to address COVID-19. But if they are like churning out wrong information, that means they may mislead people in terms of the actions that they are supposed to take. That means they can distort some of the measures that maybe the governments and other health authorities are trying or are putting in place as in an attempt to contain the COVID-19 pandemic. I think I'll pause here for now.
Okay, thank you so much, Vusa. Good to see Tonderai from Wajira Community Radio Station, and we have Malvin Daka from Wange Community Radio. Thank you so much. Great joy from Kabazwe. South Africa, Mpumelelo Ncube. Thank you everybody for joining us in. And Vusa,
yes.
You mentioned that most community radios are not adequately equipped. Is there a way of making sure that community radios are then adequately equipped to make sure that the information that is disseminated out there is credible instead of fake news? Because I take it when you are a community radio station, you are more like the grassroots or the first go-to informator for people around. Is there any way that maybe community radios need to do, or what they need to get to make them better equipped?
Yeah, yeah, I think there are a number of things that can things that that needs to be done is training, because for anyone to operate, whether it's a community radio station or a national media house or whatever, they need to have the right skills. But you find that for community radio stations, most of the community radio stations that I've interacted with, you will find that the only full-time staff members or personnel would be the station manager and the accountant. Yeah, usually those two, and maybe a third person in a producer. But usually you find that most of them have just a few full-time personnel. Then the rest are volunteers, maybe people who are just waiting for their school results, or who are just maybe waiting for their next career move. They just go and volunteer, but they are not really there. First thing that needs to be done is to build the human resource capacity of the community radio stations for them to be able to attract and retain the right personnel. Like if you look at maybe the payment or the salaries or the working conditions for personnel at community radio stations, and you compare them with their colleagues in national radio stations doing almost the same work, but you find that the conditions are very different. So first you need to build the capacity of the people working there so that there is an ongoing like support, so that as the volunteers are coming in, they are equipped, and even if they are not full-time at the station, they are able to run with it in a manner that will be enable the station to not to churn out fake news. There's also need to support equipment such as voice recorders, mobile phones, and other equipment, just to enable them to connect. Because like now with COVID-19, a lot of us are working remotely using different channels to interact with our audiences, our stakeholders remotely, maybe using mobile phones, using emails and stuff. But for some community radio stations, you find that in most cases, they are under-resourced in that regard. So they need also that technical support in terms of equipment like recorders, mobile phones, broadband, laptops, and stuff like that, so that they are able to interact with their communities. Because as it stands now, most of the time, because I have interacted with a car, or there's just a motorbike that is used by one person, and for them to move from different corners, or for them to cover different parts of that community, it becomes a challenge. So they just have to rely mostly on people just maybe like walk-in interviews, or people just sending information. But for them to be able to go out and verify that information, it becomes a challenge. And there is no guarantee that all the information they will receive will be from authentic sources, or it will not be fake news. So because of that limited technical capacity, they also get exposed in terms of, because their capacity to verify or to debunk fake news is compromised.
Okay. For that informative, yeah. And you know what, I would like to acknowledge people from Tanzania. Sorry, Amua Rushita from Jami FM Radio Mtwara. I hope I pronounced that correctly. From Tanzania. I see my brothers from Mubemu Ganga Community Radio in Chipinge. Thank you so much, guys, for joining us. I think right now what I would do is I would like to acknowledge UNESCO, Al Amin Yusuf, and Yin Fenyi and Ingrid Tagwirei from who are representing UNESCO. Thank you so much for joining us. Melod Masunda, thank you so much for joining us. Trevor, my brother from Kumakomo Community Radio in Mutare, thank you so much. Radios from the region decided to come out in full force. Thank you so much. Okay, Chris, please take over. You are the fact finders, guys, and we trust you to give us a little bit more information on fact finding. How can community radios do a better job in fact finding, considering the fact that most community radios, like what Vusa said, suffer from inadequate equipment and human resources?
Thank you, Nonhlanhla, and thank you, all colleagues, and to our partners from UNESCO, the EU, and our colleagues from East Africa. Welcome to this very important discussion. I think that I would like to make 3 points before tackling the question that Nonhlanhla has posed to me. And the first point that I would like to make is that I think radio and media generally is an opportunity to rebuild trust with the public and the audiences. And that opportunity has come through, unfortunately, a tragedy, and the tragedy of COVID-19. Everyone is looking to media at the moment. People are looking for information. And therefore, if we are able to come through as media to focus for once globally on an issue of life and death, and tackle that I think it is an opportunity first to ensure that the public realizes our role, and that we, on our part, underlining our professionalism and our commitment to serving the various publics in terms of public interest information. So COVID-19 is an opportunity for media to rebuild sometimes lost or doubtful trust with the public. It is also an opportunity for media sometimes to focus in a very big way on issues that matter. Generally, health has been treated as a secondary bit or subject in many newsrooms and by many media houses. Health is life, therefore it cannot be a secondary subject. It is a primary bit where we need to build skills, where we need to build knowledge, where we need to pour resources and ensure that we're doing as well in that field as we have sometimes devoted globally to our obsession with politics. But that at the end of the day, you can only politic to people who are alive, who are healthy, and that if their life and health is threatened, the order of life is reorganized in terms of what matters. So that's the first point I want to make. The second point I would like to make is that I think is to say to colleagues, all the radio projects around not just Zimbabwe, but around our region, in East Africa and on the continent, because we have an opportunity as well to try pick up on a subject that connects really directly with the communities. And what that means is that it is a subject that we must approach with our best skills, our deepest commitment, and with as much resources as we can. As I said in my first point, health, and particularly, is not a secondary, but a really primary issue. The third point, before I come in, is that we have an opportunity as well for once to connect, but with communities, that we begin to democratize our media spaces as much as possible by crowdsourcing what the public needs to know about certain things. And I think while we sit in our newsrooms daily and decide that these are the issues of the day, what would also matter is that we also go to the same communities, and that in our various platforms, we find a way in which we are able to use community feedback and community needs to also direct a newsroom and radio and newspaper and media operations. I think that way we will be making a serious connection. And I'm happy that our colleagues from UNESCO are on board, because they work in this field, that we have the EU as well to try build some of our capacities. So about capacity. This is the opportunity, Vusi, to go in and say, we are facing an issue of life and death. We would like to capacity building in this area. Coming to the question, my sister Nontaka, about what should we be doing to debunk false news, fake news, misleading news, propaganda, disinformation in this critical area. And the three things that we should be doing at the first. The first is to address our knowledge base in the various elements. Yes, we'll never get to a stage where we have all the resources in terms of personnel that we need. But what we should also ensure is that for those who are already in our structures, these are people who are knowledgeable, who are hungry for information, with a sense of community and public that we need to do that. At each of our stages, we go to our newsrooms and to our structures or radio stations and say, what is the knowledge base that we need? What are we missing? And in relation to COVID-19 in particular, that knowledge comes in two forms. It is knowledge about understanding that this is a pandemic which science and our health authorities are battling to understand. So the information that we get is changing almost daily. So your newsroom and your radio leaders need to be on top of the information. And that means reading a lot, and not reading executive summaries of research papers or from the World Health Organization or any experts, whether the ministries, the science, the scientists, the doctors, but that we go to the methodology of what they are, because they are grappling. This is a science. We need to know how they got there. So it cannot be an artificial approach to a very grave subject. We must bring commitment in terms of looking for knowledge. So our leaders must be extremely knowledgeable. The second is that in terms of the skills, we need to develop skills, and radio is a lot easier because you break the barriers in terms of communicating. We need to be developing ways in which we communicate very effectively on the subjects that are important to people. That we are working in terms of those skills as well. Networking, when do we restrict ourselves to simply a news item? When do and fact sheets? When do we bring in experts into the thing? What systems do we have? So those are skills that we do, and we should not be afraid to experiment, but our feedback should be coming from the communities. What did you like about our program? What did you find missing? How can we improve it? And this is something that we should be doing daily on almost all our programs, that we need feedback in order to connect with the public. That we will be doing. The third and last about what you should be doing is learning just very basic skills on fact checking. It is important that, particularly in the era of COVID, which is an issue of life and death, that radio stations first, I think, not just accurate, but truthful information. Because there's a difference. You can quote me accurately when I'm talking garbage, right? But I should be in a space where I'm talking accurately, but also truthfully. And we get to the truth when we are quoting credible sources. And in our newsrooms all over today, what I would encourage colleagues to put out a little banner out there which says, how do we know this information? Because when we ask ourselves, how do we know, we are already fact checking, right? So how do we know is because we've sourced it from credible sources, from the experts who are working in this. So we need the basic skills, and there's a 5-step guideline, and we're offering ourselves for colleagues who are in the ZACRAS community, that we can partner with you and do for the different radio stations a 30-minute introduction to fact checking. And it's very easy. What we're looking at is identifying the original source of information, that we verify the content that we are publishing, and that when we've verified, we've checked the context of that information, and we obtain permission if we are using other people's information to publicize that information. And at the end, we set out the evidence that, for example, the World Health Organization has already said, yes, while our traditional medicine, while our laboratory produced medicines are there, there is no cure at the moment for, and we set out the systems. So we could discuss those 3 points for further discussions, and that we could also help colleagues just to do a basic skills training on fact checking, and that we should commit ourselves to this, because these are issues of life and death. If we allow misinformation, it will put people off guard and it will threaten their health. If we allow misinformation to thrive, what it will do is that it will undermine the credibility of media, because people are looking to media and the professional media to debunk some of the information that is circulating largely on social media platforms. And that we should use the same social media platforms also, even as radio, to reach out to larger audiences, to debunk the information and truthful information. Thank you, Nonhlanhla. I hope I haven't taken too much of your time, but I thought if we laid that as our baseline of discussion about what we could do, we can then have a much more fruitful discussion.
Thank you so much, Chris. And I would like to acknowledge a few more other people. Hopefully, I'm not going to take too much of anyone's time. Monica Mayuni from Zambia, thank you so much for joining us. And Morongwa from Botswana. I see we've got quite a number of journalists that are in here, some that are in the community radio much for joining in this informative discussion. And Doreen, thank you that you have rejoined us again. Doreen, if you may take over and share with us your experiences in Kenya. I know you've had quite a lot of experiences in Kenya. And maybe before Doreen can come in, Chris, what are the gaps? What has been your assessment so far in terms of community radio and reporting on COVID-19? What gaps have you assessed? What gaps have you maybe pointed out? Have you seen that maybe community radios need to work on? Maybe not just community radios, but just the media at large, but especially community radios.
Thank you, Nonhla. I think the two gaps, and they don't just apply to our community radio colleagues. I think they cut across our media platforms. We not consistently and timely enough. I think that's the first that we should seek out, particularly where we are facing, like I was saying, this COVID pandemic. It is a case of life and death, and therefore,
saka apa ndamirira doro runzi riri kupinda na 2 saka paropinda na 2 koflotwa nekuningirikina maybe
sorry guys,
vachingopedzawo ndoenda kutoloja.
Sorry, we got a little bit of a distraction there. I was saying that I think the two areas where we as media, there are gaps. The first one is the gap around that we're not doing it consistently and we're not doing it timely. And this requires that I think daily, because we are having to live with COVID as the world until there's a solution to this. So it cannot be one of the subjects. It is the primary subject at this stage. So false information has to be debunked consistently. And I know sometimes we think we debunked it last week, but if we see, for example, that in the various social media platforms, the same information is being circulated again, we should come back to it. That's the first timely, consistent debunking of information. The second gap that is there is that as media on all our platforms, we must find ways in which to save information that is practically relevant information for the various public, and it is to package it in a manner that is easy to consume. And we checking information, we've said we debunk information, but we also provide information. We debunk information that is false, then we try to provide information that is useful. And some of that information could be as basic, it could be as basic as telling our various communities every day that in our community, although the numbers are produced from head office in Harare or in Lusaka or in Dar es Salaam, says the numbers are this. In our communities, the numbers are this. This thing is for real. The facilities that are available to us in Rwanda, in Gokwe, in Plumtree, in Kariba are the following. I think that we take for granted that people know where these are. We should not take for granted that people know where the information is. We can never do enough in terms of serving around issues of life and death. And the third point, where are the gaps? The gaps has been in relegating the coverage of information of COVID and health issues to a secondary role. It is a primary issue, so we need to bring in skills development. We need to network with others who are already working in those areas. We also need to ensure that our media development partners, whether UNESCO and EU, we are inviting them around capacity building and inviting them to help us connect with the various publics, and that on our part, our commitment to the same issues are never in doubt. So that I think in a nutshell, that's where I see the gaps, not just in community radio stations, but across our media. But the community radio stations are better placed because they are in the communities. They link better with the media than sometimes media that is just based in our capitals or in our other major cities in our region.
Okay, thank you so much, Chris. And Doreen, are you there? I would like to acknowledge Pelagia Kapuya, the chairperson of ZACRAS. Thank you so much for joining us. And Doreen had been booted out. I don't know, you know, this internet things. She got booted out earlier, but I'm told she is back on. Doreen, if you can take over in Kenya. Doreen, if you can take over. And everyone else. Hear me. Yes, I can hear you. Please, everyone else, can you mute your mics? If you have anything to say, please, can you jot it down in the chat box? Thank you.
Yes, I'm sorry, it's raining here, so the internet is a bit slow. So I'm hoping you can hear me. Being a community journalist and working with the community, to us, this COVID-19 pandemic has given us a platform to learn a lot. Fake news have been there, but when it comes to fake news and you're dealing with this pandemic where it's a disease that is new and we are all learning how to live with it. We are all learning how to give accurate and factual information. So to us, it has been a learning experience.
Please, can you mute your mics? Can you mute your mics? Doreen, are you still there?
Yes, I'm still there.
Okay, please, I think, is it Anseta? Please, can you mute your mic? Thank you. You can go ahead, Doreen. We're still listening. You can go ahead. Please, can you share your lived experiences in Kenya?
As I was saying
again,
the last speaker talked about. Yes, as I was saying, as the last speaker has said, our experience basically is learning and also listening to our listener. We have learned to let the community tell us what they are hearing. Us as community journalists has been a collaborative effort. It's not something that I would do alone. as community, as Coach FM know, we have decided we work together as community radio station. And so we have a platform where through the help with organizations like Kenya Community Media Network, we are able to come together and create content together, fact check together, because we find it's a bit tricky, you know, as alone, you know, fact checking. So it's a collaborative effort. So to us, the experience we have had is working together has helped us to keep on informing our audience accurately, and again, making sure that information is frequent and consistent. So I would say working closely with the government, with the ministry, making sure that our audience gets information accurately and frequently.
Okay, thank you, Doreen. You mentioned that you've been working with the Ministry of Health in Kenya in getting information to do with COVID-19. How easy has it been for you as a community reporter to get information, maybe vice versa, someone from the mainstream media to get information from the ministry? And if anyone else, I mean, some of our participants, if you've had maybe difficulties in getting information from your relevant ministries of health in your respective countries, maybe you can share your experiences in the chat box. So how has it been? Has information as a community journalist?
I would say on our side, it hasn't been that difficult because we already have a way of how we work with the Ministry of Health through the local health workers, through the local health workers who are near, understand our audience too. Those are the people who understand the modality on how our audience relate to what we talk, even the language themselves. They understand, they're able to articulate
I think you've Doreen, are you still there? Okay, maybe let me move to Vusa. Vusa, in Zambia, there's quite a few of journalists from Zambia right now participating in this discussion. And I have a question here from one of our panelists, from one of our participants. They're saying, how best can the community media in the deep rural keep the list?
Yeah, thank you very much. I think Doreen and also earlier Mkoma Chris mentioned the importance of the community radio stations collaborating or using local networks, local stakeholders, because wherever the community radio stations, like where they are located, they are not in an island. They operate within the communities. They are surrounded by different stakeholders, and those stakeholders include experts, they include government officials, they include civil society, the private sector, and stuff. So I think what is important is for the community radio station to, I can hear people greeting each other. I think some didn't hear the request for them to mute their mics.
Cardinal, can you please mute your mic?
Explaining that community radio stations, I think each community radio station is driven by a specific objective, which is usually centered around informing or providing a platform for that community. So that platform is informed by what are the issues affecting a specific community, what are the sources of the problems, what are the causes of the problems affecting that community, who is causing them, and what role can the different community members play. So when you understand that, then it informs the radio station in terms of who they can interact with, who they can approach for information. And for scientific or technical issues such as COVID-19, of course, I think we always emphasize the need for them to, whatever they get from their different sources, to also the official data from the Ministry of Health, the World Health Organization, the local, maybe district health offices, and other experts who are well positioned to speak on these issues. Because the challenge with a scientific issue such as COVID-19 is that if just one misleading sentence can create more problems than it is trying to address. So I think it's important for community radio stations to work with local networks, but also to, like, not to limit your sources within the community, maybe within the district, but also collaborate with other community radio stations. Like, for example, that is where initiatives like ZACRAS come in, where you provide that platform where come together, they share knowledge, they share ideas, they share opportunities, even in terms of maybe accessing certain resources that they may need. And then also maybe lastly, it's also for the community members themselves, because community radio stations are about the community, and it's not supposed to be a one-way kind of arrangement where information is only flowing from the radio station to the community. But there is also need to equip the community members to appreciate the role of the station and how they can use it to amplify their own voices, how they can use it to engage with decision makers, how they can use the radio station to maybe demand answers or to influence certain actions by the authorities. I think
Thank you so much, Vusa. There's quite a few comments here. There's one comment from Matobo Community Radio Trust, and it reads, from my experience, verifying rumor with the authority is one of the challenges. For example, yesterday, a message circulated on our community groups that four persons had tested positive at a local isolation center. A member of our team tried verifying that with the district authority, but some 36 hours later, there is no response. Another rumor now in chat groups say someone has absconded from the same isolation center. Basically, verifying information with authorities needs to be efficient. At the moment, it is an uphill. So I'm sure most community radios, maybe in Zimbabwe and in the region, maybe they share the same sentiment. And Tulo Mapala also says, is a bit tricky because we as community radios are not really recognized, as one as of now. So even if or when you try to verify something with relevant authorities, you get the "who are you" notion. It's a great challenge. So right now we'll open to we'll open the floor for questions. Anyone who's got questions for Chris, for Doreen. I don't know if Doreen is still on. Doreen, are you still on? And Vusumuzi on
Yes,
community
I'm still on.
radios. Okay, thank you, Doreen. So if anyone, because I see most of our participants are people that are already on the field, they are community radio movers in their respective countries. So please, any questions, this is the time.
Yeah, maybe as the colleagues are preparing their questions or comments, I can react to the question in terms of challenges that community radio stations face in terms of verifying information. And I think maybe just to it's not just community radio stations that face challenges in terms of verifying information. I think all media, whether they are national, even international, they face that challenge, but that is not, we should not use that maybe as an excuse for then running stuff that is not verified. I think that is where, as journalists, that is what differentiates us from to be able, even if like maybe verifying is a challenge, you still are able to try other alternatives, try other options of getting the information without breaking the law, because you cannot then just go out and say someone has absconded, this is what we got, without verifying. So I think earlier Mr. Chinaka emphasized the need for media practitioners to build a network of credible sources. Like as a journalist, when I remember when I started practicing as a journalist, I had a small notebook where like you write certain key contacts, you know that, okay, like now the topical issue is COVID-19. I'll definitely need to talk to health experts. I'll need to talk to maybe people from the local authority, people who are familiar with the local, creating a relationship with those people before you even approach them for a comment. So most of the time, people say, like someone mentioned that they will ask to say, who are you? It's like, I think that is normal because they are interacting with you for the first time. But if you develop that relationship, you build that trust, they know your radio station as a credible platform. You find that at times they may reach out to you even before you contact them, because they know that you are a credible radio station. They know that maybe for now you are not licensed, but the channel wherever you are sharing your content, you are reaching a certain audience that they think needs to receive information about the work they are doing. I think once you build that trust, you find that the instances of people asking, who are you? Earlier, Mr. Chinak actually addressed this indirectly, and maybe we can request him to like respond to that in more detail.
Thank you so much, Vusa. I have a question for Chris, but before I go to Chris, there's Lakson. Lakson would like to ask a question. You have your hand raised. Please, can you please ask your question just in brief, because I think we're running short of time. Then I'll forward the other question that is directed at Chris to him after Lakson has spoken. Thank you.
All right, thank you very much. First of all, I just want to offer my gratitude over all the speeches that have been made so far, and they've been very insightful. Being in the media for quite some time, I've noticed that community media has a problem with issues of sustainability, and this has compromised a lot of on politicians giving money to journalists and reporters who go to cover them, and this has had a huge negative impact on the news items that are run, on the biasness, on the balance. So I'm just wondering how best the news team can be helped, and generally community media in Zambia as a whole, in terms of sustainability, to make them financially independent, so they can stop depending on these freebies that end up compromising the standards of the editorial.
Okay, Lakson, did you say the media in Zambia?
I've worked a number of times with community media in Zambia, and I think that is one of the weaknesses that I've spotted. Financial independence has led to a lot of newsrooms being compromised. Because like Vusi earlier said, there's a weakness of using God and collect news. So when somebody, politician, takes them out, there's what they call free lunch, you know, transport refunds and all that. So that's a blalizo. So they say, yeah, you know, that coupled with a number of other financial constraints has led to a newsroom being compromised. So how best then can community media be helped remain sustainable and financially independent so that they retain their editorial independence?
Okay.
Okay,
thank you.
Thank you, Lakson. I think, Vusa, that question is directed at you because he's more concerned about the happenings that have been happening in Zambia. But there's Lynette. Lynette has her hand raised. Please, can you say, can you ask your question? Then from there on, I'll just in brief, please, so that I can go to Chris' question and the question that Lakson just asked Vusa.
I hope you can hear me. Thank you very much for the presentations. If mine is not a question, but it's a comment, I just wanted to respond to my fellow colleague who spoke about, you know, not getting information from the Ministry of Health. So I think it's what Chris spoke about when he said that we have been treating health as a secondary issue. Now, you know, you want to, all of a sudden there's a pandemic and you now want to report on health. So obviously the sources of information are going to be skeptical. They're going to be afraid because they don't know how you cover your news. They're afraid of being misquoted. So it's a perception issue. So some of them would rather not give you information because they're afraid of being misquoted, because then they also want to keep their jobs. So I think there's need for us to have a desk within our community radio station that deals with health, so that we continuously have, you know, sources at the tips. You are not a new person, you're not a new journalist to those sources. They know who you are, you know, they've worked well within rapport. So let's not treat health like what has been said before as a secondary issue, and continue to report it as a primary issue continuously, so that these sources they make, and you want information as quick as possible. Thank you very much.
Thank you, Lynette. I hope the journalists that are here from all over in Southern Africa, from all over the region in East Africa are listening. Let's not treat health as a secondary issue. Thank you for that comment, Lynette. And Chris, there's a question for you. She says, looking at how centralized information is in Zimbabwe, how best can one get verified information at a local level? Vusa, I hope you still have the question that Lakson asked earlier.
Yes, I do.
But for now, okay. Chris, Mr. Shinaka, if you can go ahead and answer Norma's question.
Thank you, Norma. Thank you, Nonhlanhla, for the question. I think you pointing out at a problem that's not just facing communities. The issue of sources and sourcing particularly during this COVID-19 pandemic is a huge issue for media globally. And it's more pronounced at a community level because you're trying to zero in on information that relates particularly to your own community. I think the two ways easy approach. The long approach is what Vusi was talking about, that when we come into media, the two things that we do, we build on knowledge and skill on our part, but the second element that we work on, which go along with our work in media, is building a bank of sources across subjects. And so you're not calling people right when you have a crisis, and that's exactly what's happening around COVID. But the World Health Organization has introduced literally a protocol, sorry colleagues, where our health authorities in our countries have become the primary source alongside the World Health Organization itself about the information on COVID. So I'm restricting myself to COVID, and I'll come to the community. So the protocol that we have at the moment, and we have to understand it and relate with our frustrations to that protocol. But that's the reality. The protocol is that the information around this very delicate subject is entrusted with the experts in our health ministries and agencies. And at the apex, with the World Health Organization being the ultimate collector of all the data from the global. The other element, for example, is that do we know, so we are as good in journalism, we are as good as our skills and our knowledge, but we are also as good as our sources. So the three go together. So we must build sources at the local level. First, to identify, and that's an exercise that I'm challenging colleagues to go and do at the moment, and say, doctors do we have, right? So you know how many doctors exactly you have. That doctor may not be the ultimate source of your information, but the doctor has colleagues who are working at the center, who are working in these platforms, and so they become your conduit to fishing information from the other ones. You may not be able to publish it immediately on, but we have a challenge at this stage, Norma, that we started building a database of sources, of credible sources across the various disciplines, health, particularly for COVID, and in other areas, and begin reaching out to the other. That's the longer one. The short, the other way of coming to your local is to link out and say who is doing a overshadowing information around health, around water and sanitation, around different subjects in my community. So the networks that Vusi was talking about also help you to take you from someone who knows someone. So at this stage, for example, I have spent the last month or so trying to break into the closed networks of doctors and health workers. So someone invites you into their WhatsApp group, and you kind of have an idea of what they're talking about, what the assessment of the various elements are. So that's the other element. The third is that particularly in terms of fact-checking, Vusi, one of the ways is exactly what we were talking about. Instead of me fact-checking an issue, I must find out whether that issue has already been fact-checked. So at ZimFact, for example, before we fact-check, you Google around and you ask colleagues in your fact-checking, has anyone fact-checked whether if I eat mdzepete, it's likely to reduce the chance and say, no, it hasn't been done, or someone else has worked on it. So it's also to use information that is being generated by colleagues. And I think that's the subject that Vusi was talking about, that we must plug into each other's strength. So when you are fact-checking information, find out whether it has been fact-checked, because your duty may simply be to broadcast and publicize that information. So that's one way of doing it. But we do so if we have very basic skills about how we fact-check, when we have a very strong data bank of sources and credible sources, and if we understand the protocol about how the world is managing this. One last point, and to indulge colleagues, one of the difficulties that media is facing globally is that here is a subject that has been subcontracted or is in the hands of governments. Many citizens don't trust their governments as sources of information. So that's one of the problems we're already facing. But the reality is a pandemic of the magnitude of COVID, the only institutions with capacities tend to be governments working together, either as intergovernmental. So for now, we have to rely sometimes on people who you normally would not trust, because you don't trust politicians and your audiences don't trust politicians. What is one way of doing it? It is, instead of quoting the minister directly, it is to quote the coordinator of of your COVID-19 problems, because we probably believe the doctor will tell the truth because they know they are working in the area. And we are building and conveying information which does not create doubts across the area. But there are things which you can't avoid quoting the very same people sometimes whom you don't trust. That is the protocol. That is the only practical way at this stage. And you're trying to play public good. Sorry, Nonhlahla, for dragging it out, but I thought it would be useful to take a much more global view of the problem that Norma was raising.
Okay, thank you so much, Chris. We are all, whether we're in the community media sector or mainstream or wherever, but most of us here are journalists. So as Chris has advised us, that one of the fact-finding ways that we can do or that we can use is to quote the Ministry of Information or the coordinator or the one responsible for the information that is being passed on. Okay, before I move on to Vusa, you still have the question from Lakson. I have a question. Okay, I have a question from Morongwa. Morongwa is from Botswana. She's a print media, and this question will I'll pose it at Doreen. She says, I'm interested to learn how the broadcasting space deals with issues of quality control. Coming from a print environment, we have a style sheet manual or guides for newsroom members to adhere to, and the serving treats all print articles with the aid from such resourceful guides before we release stories. So I think what Moronga is trying to say is she wants to understand how then does the community radio operate, since she's more on the print media. So I'll pose that question over to Doreen, but Vusa, you can go ahead and answer Lakson. I think he's been waiting for a long time. And then afterwards, there's someone who's got their hand up. Can you please ask your question after Vusa and Doreen? Thank you.
Thank you very much, Nonhlahla. Yeah, thank you, Lakson, for that question. Indeed, I think sustainability is one of the major challenges that community radio stations are facing. And I think there are some stakeholders who tend to capitalize facing and end up maybe using that to capture them. So one of the, in terms of your question was, how can community radio stations be helped to get out of those sustainability challenges? And I think the first is, well, not necessarily maybe community radio stations getting external help, but community radio stations themselves implementing, putting in place measures to change the situation. Like for now, if you check, most commercial radio stations are going community in terms of some of their, some aspects of their programming. And I think there could be an opportunity for community radio stations to also, maybe for lack of a better word, revenge and also commercialize certain aspects